Headline, Epic Times, 0 young healthy individuals died of COVID-19, Israeli data shows.
It's probably good data because then they volunteer to experiment on the entire...
So we covered this before, and in that story, Israel was bragging. The story was bragging about how Israel has all this data. They're way ahead, and they had a special deal with Pfizer to get the vaccine first and all that stuff. Remember? And so in order to get that, they would had to provide all this data.
Yeah.
Right.
Yeah.
Well, guess
the
what?
Results
Now
of the experiment.
Now they don't have the data. Watch this. Right.
Oh.
So 0 healthy individuals under the age of 50 have died of COVID-19 in Israel, according to newly released data. 0 deceased of 18 to 49 years of age with no underlying morbidities, the Israeli Minister of Health, MOH, said in a response to a formal request from an attorney. So there was a Freedom of Information request, and they wanted to get the data on that. And the Ministry of Health said that there were 0 people deceased between the ages of 18 and 49 from COVID who didn't have underlying morbidities.
Oh, you don't say.
That's what they say. Okay, but there's more to this. That's not the end. Officials noted that the statement only applies to COVID-19 deaths where the Ministry of Health conducted an epidemiological investigation and had received information about the underlying diseases. So that doesn't mean all people between 18 and 49 who died. That just means the ones that the Ministry of Health conducted an investigation on and had received information about. What? So I thought the Ministry of Health had all this unbelievable amounts of information, but now they're saying we don't really have that much. But the writer in this article says 0 is very, very clear number and cannot be subject to interpretation. Zoev Yehekzekli, a specialist in internal medicine and medical management and former lecturer in the Department of Emergency and Disaster Management at the Tel Aviv University in Israel, told the Epic Times. So this guy says 0, it's pretty clear what's happening. Why? So if there was 0 deaths, why were all the extreme measures of school closures, vaccination of children, and lockdowns needed? That guy added. The Ministry of Health did respond to a request for comment.
They did?
Says they did.
What?
The information was sparked by a Freedom of Information request filed by attorney Ori Zabi, it's a great name, who has been filing several such requests as he seeks to obtain information from the Ministry of Health regarding the COVID-19 pandemic and the COVID-19 policies. Zabi asked to know the average age of people who died of COVID-19, segmented by vaccination status at the time of death. So he wanted to know what's the average age of people who die from COVID-19 and were they vaxxed or unvaxxed at the time of dying. And then he wanted to know how many COVID-19 patients with no underlying morbidities under the age of 50 had died. And the annual number of cardiac arrests cases between 2018 and 2022. So those are the Freedom of Information questions he asked. And the one about how many COVID-19 patients with no underlying morbidities under the age of 50 died, 0, according to the Ministry of Health, 0. But they qualify that by saying we don't have all the data, we just have certain amounts of data, which is sketchy. According to the Ministry of Health, the average age of vaccinated COVID-19 patients who died was 80 years old, 80.2 years old. The average age for unvaccinated was 77.4 years old. Now, I would like to know, did they give either of these groups treatments? Did they give them anything to treat or did they just do nothing, send them to the hospital, and then intubate them? Did they give them steroids? Did they give them fluvoxamine? Did they go any other, zinc, vitamin D3? Did they do any of the other things I'm not allowed to mention on this show?
Jimmy, and I also like to know, I feel compelled to say, actually, those who were vaccinated but then died, it did help them to die more slowly.
They did die more slowly. So that's just look at what it says. The average age of patients who died was 80.2 years old. So is that vaccinated? Yeah. So if you were vaccinated, the average, you still died. I don't know how you guys call
it
that.
doesn't say how many died, but it said if they did die, they were 80.
The Ministry of Health emphasized that the data they have about the underlying diseases of the patients is partial, since it relies on the information provided by the patients or their relatives if they chose to do so, and then only in cases in which the Ministry of Health conducted an epidemiological investigation.
What? That's not what they promised Pfizer, to get that great vaccine early.
So
they said we'll provide that information.
That's what they said.
Oh, I hope Pfizer got their information at least.
So we've already reported this, that Pfizer and the government of Israel had an arrangement that they're going to have all this information to give to Pfizer, and now they're claiming we got nothing, we don't have it. But the stuff we do have shows that 0 people under 50 died from COVID-19 that didn't have an underlying morbidity.
Do you know anyone in your life that died of it that didn't have an underlying morbidity? Just one. Do you know anyone? I know people that died from it. All of them had an underlying morbidity.
I know. Okay. No, I don't. My answer to that is no.
That's not science, but I'm telling you, I haven't met, even though I know people that died during that. Yeah. Keyboard Jeff, the Comedy Store, but he had HIV and he got Delta, and, that's a comorbidity.
Mm-hmm. Therefore, the available information does not necessarily reflect the health status of the patient. The Ministry of Health wrote, adding that they do not have access to the patient's medical records. What in the effing F? This sounds mental because of the story we reported earlier. It's not clear why the Ministry of Health responded to Zabby's request using only cases where the Ministry of Health had conducted an epidemiological investigation and which was limited to deceased patients where the families had cooperated. Since the 2020, the Ministry of Health told the Israeli Knesset that the Israeli parliament, that they use an intelligence system
I remember
that provides the Ministry of Health with extensive information about deceased patients that included underlying diseases. They've already said they have this info. But now they're saying, what? A document from the Knesset Research and Information Center dated June 7, 2020 stated that the Ministry of Health provided data to the Special Committee for the New COVID Virus about COVID-19 deaths, 298 by that day at 4:30 p.m., at the request of Yifat Shasha-Bidin, a member of the Knesset and a chair of that committee. So they were already providing all this information. The ministry's intelligence system has data on gender, age, district of residence, and the underlying diseases of the deceased, according to that document. The system showed that about 94% of the deceased were 60 years or older, and that there were no deceased with 0 underlying. So even over 60, you had to have a comorbidity to die. Like, remember Joe Rogan broke that on? Well, I first heard about it from Joe Rogan when he said, when people die, they have 3 comorbidities. The average of people who die.
What is he, a horse?
In addition, on May 4th, 2020, the medical directorate of the Ministry of Health, in a letter, issued instructions to the heads of the hospitals and medical departments of the health maintenance organizations, national healthcare organizations, on how to fill out COVID-19 death notices, directing them to include underlying diseases. And in December 22nd of 2020 letter, the medical directorate to the managers of the hospital stated that for every COVID-19 patient who died during the acute phase or due to complications of the illness later, or people who were positive for COVID-19 who died, a death notice and a summary of the case must be sent to the COVID war room of the Ministry of Health. They said that the purpose was to improve surveillance. So they've been telling us over and over and over that they've got the data. And then as soon as someone wanted to get the data, they're like, we don't got that data.
I can't believe they were more forthcoming than, here. They were like, they even gave that data.
Well, so studies and other data, including a study led by Stanford epidemiologist John Ioannidis, I can't say his name, showed that the COVID-19 mortality, even with the original variant, was largely age dependent. It was definitely a disease that actually only endangered the elderly. Over the age of 60, mortality doubled every 5 years, while under that age, mortality was negligible. And now we really see that it was 0 under the age of 50 at least. So if you didn't have a comorbidity and you got COVID and you were under 50, you didn't die. That's what they're saying. Well, here's that study. The COVID infectious fatality rate in 2020, remember, that's the most virulent strain of COVID-19. The death rate was 0.1% if you were under 70.
So not some comorbidities. That's just being under 70.
That's just being under 70.
But it's 20 times higher than the 0.001%.
There may not have been many young people who got seriously ill, yet the Ministry of Health had emphasized cases of pregnant women hospitalized in critical condition and young healthy people who died because of COVID-19. It was not the true situation, he said. They created a false presentation of the very severe epidemic that affects the entire population, and therefore the entire population should also be vaccinated regardless of age.
Oh, well, at least they had something good in mind.
So
a noble cause.
So no, he's saying they created a false presentation.
No, that's the thing. We have to scare them.
Yeah, and Dr. Drew, when I was on his show, revealed that he worked with Dr. Fauci during the AIDS crisis, and Dr. Fauci's number one way to deal with the crisis is to scare people.
You got to scare them until.
And that's what he did. He used fear, preached fear, and that's what masks were about. It was about creating a psychological state of fear.
Don't hug anyone with AIDS.
And so they made the virus seem way more deadly than it actually is. They scared the hell. I thought if I got it, I was going to die. Everybody thought they were going to die if they got COVID.
I got vaccinated immediately when it was available to me.
That's right.
I wasn't one of these nerds who were like, I think I can get in early. You know, the people that got they faked I work in the service industry, I have to get it. Some people, I didn't do that, but I got it right away.
I got it.
Because I thought we wouldn't have to wear a mask.
They said you could
put them back on.
Yeah, you're going to go, because if you get it, you're not going to, they told me I wasn't going to get the thing. I wasn't going to contract it. I wasn't going to give it to other people. Yeah. And I could go back to my regular life. That's what I was told.
How long
that was
did we have
always
masks
a
off?
line.
How long was that?
What do you mean?
You were allowed to take your mask off for 1 week. Remember that?
Yeah.
That's how well it worked.
So the point of this is they're saying that they made this all out to be way worse than it actually was, so they could sell you stuff. And that kind of is that's the truth, actually. Justification given for vaccinating pregnant women, young people, and children was that they too are affected by COVID-19. We showed you that children have a greater risk of dying from the flu than they ever did from COVID-19. It was known back then that this was not the case, and we now see it clearly, asserting that the Ministry of Health has lost the public's trust by making a false presentation of the dangers of COVID-19. That's happened here too. That's happened all around the place. Everybody keeps talking about this crisis in public health. Nobody trusts their public health institutions anymore. And that's not because of YouTubers like Jimmy Dore or Joe Rogan. That's because they lied repeatedly over and over and over and over and over about the risks of COVID, about the vaccine, about masks, about immunity, natural, herd. They lied about everything. Who was at risk, who wasn't at risk. They could not stop lying. And that's why I think they're going to have a hard time getting people to go along with their junk next time. That's my fingers crossed. We'll see. Everybody I know who votes, even the people who don't vote, they're still morons about it.
Look, Jimmy.
I'm not about how about when my friend Graham came on and was completely 100% wrong about everything, and never came back and apologized. Never said, hey, you know what? I got all that stuff wrong. Never, nothing. It just pretends like it didn't happen. It's just amazing.
Very weird.
That's just amazing to me.
By now there'd be a little bit of oh, okay, maybe it was a stupid.
You would think.
Just a little bit.
You would think that they would feel, you're right, I got scared and I repeated big pharma propaganda. They were lying.
He'd at least do a crystal ball.
We could never, ever vaccinate our way out of this. It was always going to be here forever. They always lied. We were being lied, and I wasn't skeptical of government or big pharma, and I was shaming people who were, and I hated them. Now Those people don't even talk to me anymore. Because I got COVID right. If I got COVID and the vaccine's wrong, they could forgive me, but they'll never forgive me for getting it right.
If you got it wrong, you'd say so, by the way.
And I would say so. If I got it wrong, I would say I got it wrong. I got it wrong initially. I went and got the vaccine. I told people to get the vaccine. I told people to wear masks. I got angry at people who weren't wearing masks. I was that person. And then as soon as I looked into it, after I got vaccine injured, everything I looked into, they were lying about. And I don't understand why my friends that got mad at me, instead of getting upset that they were being lied to, they don't care that they got lied to by Fauci and by the CDC and by corporate media and by big pharma and by government and by everybody. They don't care. They got upset that I got it right. They're angry at me because I got it right, and they'll never forgive me for getting it right. But I got to let you know that the vaccine is fantastic. You know that. It's safe and effective.
You heard Crystal Ball.
You know it's
talking to that monster.
Super safe. Super. It saved millions of lives, and it doesn't
slow the spread.
It doesn't stop the spread, Kurt, but it does slow the spread.
Did it work the way they said?
Did it work the way they said? No.
But it did work in a way that they didn't say. It
worked. Yeah,
just as good.
That's just as good.
And we should keep saying this. No, the whole thing was worth it. I just want to make that clear.
It was all worth it. I think we should do it again immediately. I mean, the virus is still here.
I even did the hacky. Well, I put a lot of drugs in my body over the years, so I might as well. Not realizing, those dangerous drugs that I did, all the greats, those were tested on more than 8 mice.
Yeah.
I know the effects of all of those.
Yeah. You know what I like is the comedians who demand that their MC, the headlining comedian, demand that their MCs are vaccinated and wear a mask.
What club
and
is
meanwhile, they pay hookers to piss on them. I know this for a fact.
You know Jim Norton? I don't know.
We're only acquaintances. So that's that. So that's that story. I hope you enjoyed that story from the Epic Times, saying that according to the Israeli government, the cases they investigated, 0 people under 50 died from COVID who didn't have a comorbidity. 0. That's according to the Israeli government. But of course, there's more data and stuff, so it's all murky. So we don't really know. Hey, everybody, check out my new stand-up special, COVID Lies Are Funny, only $10. And come see us live in Syracuse, Cohoes, New York, Hartford, Los Angeles, Bakersfield, Baltimore, San Francisco, Huntington Beach, and more. Pottstown, even. Go to jimmydore.com for a list of all of our things, and see you there.